Well, as a mother of an almost 2-year-old, runny noses are pretty par for the course when it comes to kids. But how do you know when it might mean more than just a week of wiping? How do you know when it's a cold, allergies, or a sinus infection? We have Dr. Evan Tobin from Ohio ENT and Allergy Physicians joining me this morning with his expert advice. Good to see you, Dr. Tobin.
Thanks for having me, Robin.
All right, so most of us we think about stuffy noses, we think about these runny noses, kind of what's going on, and we immediately think sinus infections. But do kids get sinus infections?
The answer is they get them, but not in the way that we think about with adults, for instance. Adults get pain and pressure and congestion and go to the doctor and often get on an antibiotic to treat a bacterial infection. Kids get viral infections much more commonly, and it turns out because children do have sinuses, these viral infections are a type of sinus infection, but usually not one requiring antibiotics, one that we can usually treat symptomatically. And kids will get 6 to 8 or more of these viral upper respiratory tract infections that are viral rhinosinusitis. And sometimes if the symptoms last longer than 10 to 14 days, then we start thinking, okay, the virus should have run its course. Why are the symptoms lasting so long? And those kids may have a bacterial infection and in fact may require an antibiotic.
Okay, and that's why you say, around 8 a year. That's why kids always have runny noses. It seems like it's almost like when they get rid of one, there's something else. And it's just, they're very susceptible to germs and things like that at that age.
Well, exactly right. And a lot of this depends on their daycare environment or their school environment. A lot of these viruses are passed more frequently when they're around other kids. Immune systems are still developing in younger kids, and so they'll get fewer as they get older, assuming they don't have another problem, and we'll get into some of those problems in a minute.
Yeah, and besides then a sinus infection, what can be causing that? Is that just a virus? Is that what kind of spurs it? Well,
yeah, again, an upper respiratory tract infection is the first thing that we think about, but if they're becoming more frequent, and especially if the drainage is, let's say, not a colored thick drainage, or maybe it's more of a clear drainage, or the child is acting like they're itchy, their nose is itchy, or their eyes are itchy, we might think that maybe an allergy, and so an allergy evaluation may be in order. Other things, chronic mouth breathing, chronic stuffiness and snoring, we may think of adenoid enlargement can be a cause. Environmental problems can be an issue. Kids that live maybe out in the country with a wood-burning furnace or around a cigarette smoker, that can be a non-allergic but environmental problem. And then a sinus problem or even an anatomical problem could be contributing to these symptoms.
So I imagine you have to then test to see what this issue is, right? So what kind of procedures, what kind of testing can you do?
Well, when the problems become more chronic, the primary care physician may recommend that the patient see an allergist or an ENT. And in our practice, we have allergists and ENT doctors in the same practice, which makes it convenient, and we work together. A good physical exam and a good history are going to tell us a lot of what's going on here. We'll examine the child, we'll look for certain characteristic findings that may point us towards allergies or point us towards adenoid enlargement or a sinus problem. We may do some simple x-rays, we may do allergy testing, there's some blood tests that we'll do to check the immune system. We may even order a CAT scan that can be done in the office. It's simple, it's seated, it's low radiation, and we can get a lot of information from that. And then we may do a very simple endoscopic examination in the office where we can actually look into the nasal passages and look back to look for a problem that may not be evident with a regular physical exam.
And when you talk about that, we're looking at this photo here, and so these are the areas you are looking at for a lot of these issues to which a parent is not going to be able to see, with our common eye kind of thing, right?
Yeah.
And then these are tools we can use, or?
Well, these are some of the over-the-counter treatments that are available, and what I have learned is that there's so much available that it's confusing. A parent goes in, they know they have a child with a stuffy nose, and what should they try first? Well, we love saline. Saline, our noses do well with a little bit more saline. It thins out the mucus, washes it away, cleans out environmental allergens and contaminants. And so saline mist and saline irrigations are just a mainstay of treatment for allergists and ENTs. Nasal steroids are available over the counter. I wouldn't want a mom to put her child on a nasal steroid without talking to their doctor first, but we'll use these medications down to age 2.
Okay, and is surgery ever necessary for a child?
Surgery is an option when medical treatment is not working or when it's just kind of becoming burdensome. And these things are, it's always scary to think about surgery, but with kids we're thinking about very routine surgeries with quick recoveries, removal of the adenoid tissues in the back part of the nasal passage. By removing that tissue, we can open up a blockage. We might cauterize the turbinate tissue to open up the nose a little bit. Sometimes tonsils, ear tubes might go along with some of these things as well.
Okay, but of course, if you are unsure, like you said, Dr. Tobin, talk to your primary care, talk to a specialist, figure out what's going on and get those kids back in good shape. So thank you so much for being with us.
Yeah, thanks for having me.